welcome back to my channel Ages Kingdom. In this class, I would like to talk about factors affecting nutrition. It is a syllabus from BSc Nursing second semester, and even it is included in the nutrition and community of BSc Nursing third year, second year, and fourth year. Let's have a look. Factors affecting nutrition. Suppose individual want to have a good healthy nutrition in the society or in the family or within ourselves, what are the factors are which contributing for the nutrition, we will discuss. So let's start the topic. When you go with the word itself is saying and the factors, the first factor in India is a developing country. The first factor which involved in the nutrition is socio-economic status. Yes, it plays a major role in the nutrition. If you are affordable and giving a good healthy, affordable and getting a good healthy diet, definitely your health also will maintain in the same way. So India is a developing country. In the low socio-economic status, people mostly it is result with malnutrition. If they are high socio-economic status, it will result with overnutrition or obesity. So here our nutrition was affected by the low socioeconomic status and high economic status. Low socioeconomic result with undernutrition, high economic status may be with overnutrition also, and it can result with obesity. And cultural practices obviously influence your nutrition, like what kind of practices are there at home and what kind of practices are there at your community. These cultural factors will influence your nutrition. So some factors may suggest that this food need to be eaten and this food not to take, and that food has to be taken, and this is not usually taken by our culture. So those kind of things may be common in some of the factors. So what you have to do here is um cultural factors also plays a very important role. That is then local traditional practices obviously it will influence, and agricultural production also plays a very important role in the nutrition, because what kind of cultivation is happening in your geographical area, what kind of foods are available in your area, or what kind of fortification of food items or the preparation or the production of food items are there. This is all definitely influence your nutrition. For instance, some parts of our India consumes more carbohydrates but less protein, and whereas some parts of north side they eat more wheat than the rice based food. So agricultural production also plays a very important role in the nutrition. And system of distribution of the food, like what kind of food items are distributed throughout the country, like it is in the central or state level or to the peripheral level or the village level, what kind of food distribution is there, that also plays a very important role in the nutrition. And lifestyle, food habits, obviously lifestyle and food habits plays a very important role in nutrition. Suppose if you are a foodie, or if you are eating a more food, and that maybe leads to obesity, and maybe your lifestyle like alcohol or smoking or use of any drugs, that may reduce the consumption of nutrients, and you may consume a non-nutritive substances, that also will affect your nutrition. This is a one important thing I would like to say. And next, see, this can be even classified more better way, in a different way. You just look at this here, like your age and development, gender, health status. Definitely your health condition also plays a very important role in the nutrition. Suppose you are a known case of diarrhea, or you are a known case of diabetes, known case of hypertension, definitely your nutrition also will affect according to your health condition. And already substance abuse like alcohol, smoking, or any drug abuses also will affect your nutrition. And even the medications also plays a very important role in your nutrition, because if you take any kind of medications, for instance antibiotics, if you take antibiotics there is a chances of diarrhea, and when you have a diarrhea there is an imbalance in the nutrition. When you take that, may be gone as a diarrhea and it is not absorbed properly, so your medications also can affect your nutrition. And sometimes your supplements also can varies your nutritional absorbance, like you may take a protein supplementations or some that kind of things also can affect your nutrition. So overall I can say the factors affecting food and nutrition is like weight, age, sex, cultural environment, physical activities, then physiological status, socioeconomic status, cultural factors, lifestyle, food facts. Food facts is another important word we have to remember. Like we say, people have some beliefs towards or myths, we say myths, myths. It indicates that people may have some traditional ideas regarding the foods, like if you eat egg you may get a bald head, or if you eat tomato you will get a kidney stones, or so such kind of things. People have a create images in their mind and they try to avoid some kind of foods, so that also may affects your nutrition. That also may affects your nutrition. So what does it mean is, so socioeconomic factors, cultural factors, lifestyles and food habits, food facts, like myths or beliefs towards the food, and cooking practices, like what kind of practices, maybe you are eating a more oily food or more boil method you are using, so that also may affect your nutrition. And cooking practices and child rearing practices, because one culture will play one type of cultural practices in rearing the children, like they will not give any food until they become 1 year, some practices, and some people may be taking a nutrition by fourth month itself. So what kind of child rearing practices are there, that also will affect your nutrition. And your religion plays a very important role. For instance, in some religions they may not eat non-vegetarian food, so that affects the nutrition. But there are other alternative methods are there to supplement such kind of nutritional loss, so we have to maintain that. If you are maintaining that, you may not, even the religion practices also cannot affect your nutrition. And traditional practice means nowadays everybody started taking a fast food, so that fast foods have a high products of maida, which can affect your nutrition, and you may be becoming over nutrition. Sometimes it can be a undernutrition also, and sometimes that kind of food items can cause cancerous kind of illness also. These are the factors affecting food and nutrition. Thank you for watching. If you really like my class, please do subscribe. Thank you.